Welcome to the overview of SizweHosmed Medical Scheme benefits for 2022, brought to you by NMG Benefits. This video highlights and summarizes the various options available on SizweHosmed. Details on the hospital cover, chronic cover, day-to-day benefits and contributions will be shared with you in this video. NMG is an authorized financial services provider and is here to help you with your medical scheme membership. Our consultants are fully accredited with the FSCA, the Council for Medical Schemes, and your medical scheme. As one of the largest financial services intermediaries in South Africa with more than 25 years of experience, we can assist with various elements of your medical scheme and provide you with sound, independent advice. Let's move on to an overview of the three components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization may be limited or unlimited depending on the plan you choose. The actual rate at which you're covered for treatment in hospital will vary once again by your plan choice. This rate is reflected as a percentage of the scheme rate and will increase from 100% cover to a higher percentage depending on your plan choice. Planned hospital procedures need to be pre-authorized with your medical scheme by contacting the number on your membership card. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. It is recommended that members carry their membership cards with them at all times. Members opting for one of the efficiency discount options, that is EDO options, will need to make use of network hospitals in the case of planned procedures. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you are covered for hospital shortfalls. These shortfalls arise because there's no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value and/or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in hospital shortfalls. Let's move on to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. By way of example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should you be diagnosed with a chronic condition, it is important to apply for the chronic illness benefits through your treating doctor in order to register your condition under the chronic benefit. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list, known as a formulary, to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment will apply. Chat to your doctor about the possibility of changing to a formulary medicine to avoid this shortfall. Members on certain plans may be required to make use of a designated service provider to avoid a co-payment on chronic medication. The designated service provider for all plans on Sizwe is Medipost. The screening benefit. SizweHosmed offers members a comprehensive list of screening benefits which are paid from risk. These assessments are done to help members either prevent illness or address specific conditions they may have already. This benefit will include the following: health screening tests, 1 blood pressure, blood sugar, cholesterol, BMI and HIV each year, a female mammogram for members 40 years and over, and a pap smear for members over the age of 18 years per year, and a prostate angiogen screening for males over the age of 40 years. Preventative care benefits are also available. vaccinations for flu, pneumococcal, HPV, baby immunizations, COVID-19, as well as female contraceptives. Let's take a closer look at your day-to-day benefits. The level of cover and the way your day-to-day benefits are paid depends on your plan. SizweHosmed offers members a choice of 3 types of day-to-day benefits. The Silver Hospital plan has no day-to-day benefits, therefore, members will have to self-fund medical expenses incurred outside of the hospital admission. Essential Copper is a capitated option where members are restricted to using certain hospitals and day-to-day provider networks to access their benefits. Contributions are determined by your income. The Access Saver plans are divided into 2 options, one with a 25% of total contribution and the other with a 15% of total contributions allocated to the medical savings account. Members are required to manage funds themselves in this regard and can use the benefit at any provider of their choice. Please note that medical savings accounts are allocated at the beginning of the year for the full year, or on the effective date of a new policy during the year for the rest of that year. Unused medical savings account balances as at 31st December of every year will be carried forward to the new year. Please speak to an NMG consultant to review the impact of this benefit should there be any financial changes during the year, example, termination of membership. Members joining the Titanium Executive Plus option, Platinum Enhance, Gold Ascend and Value options will benefit from a traditional structure of benefit offerings. There will be an overall annual limit for the day-to-day benefit with different sublimits that won't affect each other, provided that the overall annual limit has not been reached. Please take note that certain benefit limits may require the use of a designated service provider. In addition, unused benefits by the 31st of December each year will fall away, and a new set of benefits will be provided effective from the 1st of January of each year. SizweHosmed also offers comprehensive benefits for maternity. Some of these include antenatal consultations, pregnancy scans, hemoglobin measurement tests, blood grouping test, VDRL test for syphilis, HIV blood tests, urine analysis tests, and a full blood count test. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. The Titanium Executive option reimburses hospital claims at 300% of the scheme rate, plus at 200%, and the balance of the plans reimbursed at 100%. The plans with an option for EDO will require the use of network hospitals for planned admissions. If you do not use a network hospital for planned procedures, your hospital claim may not be paid, or penalties will be applied. For emergency treatment, members on these plans may utilize any hospital. On the chronic side, all plans cover the standard 27 chronic conditions, but you will notice that some plans have additional chronic illnesses that are covered, particularly the Titanium Executive, Platinum Enhance, Plus and Value. Titanium Executive, Platinum Enhance, Plus, Value and Gold Ascend options offer the traditional structure for day-to-day benefits. The higher the premium, the higher the overall annual limit. The Value option will require members to use network providers to access day-to-day benefits. Premiums on these options will range from 2,679 Rand to 6,585 Rand for a main member contribution. The Access Saver 15, 25 and Silver Hospital plan offer 100% hospital cover for planned admissions at any private hospital. The Access Saver will allow members to choose a 25% or 15% of total contribution for day-to-day benefits. The Silver Hospital option has no day-to-day benefits. Therefore, medical expenses incurred outside of a hospital admission will need to be self-funded by the member. Essential Copper is a cost-effective, income-based option which offers members the following benefits: unlimited cover for hospital admissions, cover for 27 PMB chronic conditions, unlimited cover for medically appropriate GP consultations out of hospital, blood tests, x-rays, or medicine through the SizweHosmed network, a 30% co-payment for out-of-network GP visits, basic optometry once every 2 years, basic dentistry, unlimited prescribed medication subject to formulary, and monthly contributions are determined on the member's monthly salary. We're now going to take you through your contributions for the new year. These increases will come into effect from the 1st of January 2022. Should you like to speak to a consultant for more information, please contact us at one of our branches. Although we make every effort to get things right, there may be times when you feel that you have not received the level of service you're entitled to. In such instances, please refer to our complaints procedure, which can be downloaded from our website, www.nmg.co.za. Thanks for your time and take care.